Physical therapy is comprised of compassionate care towards the patient and showing or giving the quality care that the patients deserve in order for them to go back to their highest functional capabilities. PT profession involves also yung treating the patients, assessing the patient, and administrative duties. So in my case, I am the internship coordinator of the PMRD. So I teach interns, I provide case presentation for them, I teach them how to treat patients well, and mostly I do the grades, encoding of the grades of the interns, orientation of the interns, and charting procedures. As clinicians, we should not always stick to what is written on the book. So we should always be open-minded with regards to the new trends in rehabilitation, in new trends in treating patients. So with regards to the skills, so through experience, we'll be able to handle all the patients. So if given this kind of case, we'll be able to give type of treatment, kung ano yung pagkakasunod-sunod. We have musculoskeletal team, neurological team. So every month we try to rotate our patients so that we will be able to gain more experience in handling different cases. Group effort is the best thing that I can give to you because we here in Philippine Heart Center, we cater to a lot of patients. The difference between the two is that when you handle neurological cases, you design a well-prepared exercise regimen for the patient. If you want to strengthen the quadriceps, the hamstring, so more of the strengthening and how you manage well the patients with regards to ambulation. It's a group effort also, especially when the patient is very passive. For example, I am at the back of the patient and I assist in moving the patient, and the other one is focusing on the lower extremity of the patient. If you handle naman musculoskeletal conditions, so you try to know what are the impairments of the patient. So assessing the patient is very important. When you see there's tightness, when you see there's weakness, you have to assess it first before proceeding with the treatment, not just reading the prescription of the doctor. The prescription of the doctor will only serve as a guide, and you will be the one to gradually progress the exercise of the patient. So it's really a collaborative approach to the patient. That would be if the case would be neurological case. If the patient is not able to ambulate when you first handle the patient, I think the most fulfilling part is that they can walk alone without any assistive device. They will be able to walk in the community, to regain back their normal function at work, at the home. And in cases of musculoskeletal patients naman, so I think that would be if they would have any pain. So if you'd be able to go back to work without any complaints of difficulty, without any complaints of pain. For me, the most challenging is that I'm treating patients all at once. So you try to think when you're treating another patient. You don't just stick to your patient at the time. So you try to think, what can you do to the patient if they are still waiting? So you can, I think that's the most challenging. If for example, your time management, you try to think things on your own on how well you will be efficiently managing the patient. Toxic. So I'm treating mostly 11 patients like that. So I think that's the challenge for us therapists, to handle well our patients and do not receive any complaints from them. We, as a Filipino, produce patient-focused quality care. We show patients the compassion and the atmosphere they deserve from us. So I advise yung mga students pa lang to study and work hard, focus on your basics, maximize well your clinical experience during your internship. So grow professionally during the internship